Did the American College of Cardiology just say that medication should come before diet and exercise? Yep. And for many patients, that's absolutely right. But before you toss out your treadmill, let's talk about what this actually means. This new guideline is already controversial, and I get why. We've been told for decades, eat less, move more. But science and the human body, it's not that simple. So let's break it down. In June of 2025, the ACC dropped a major update. For the first time ever, they said obesity medications like semaglutide and tirzepatide should be considered first-line treatment for eligible patients. Not second line, not as a backup, but first line. Why is that? Because meds are doing more than just helping people lose pounds. They're reducing heart attacks, strokes, and other life-threatening complications. That's not hype. There's hard data to support that. And here's the kicker. They're not saying patients have to fail diet and exercise first. That barrier is gone. Modern obesity medicines aren't like the old ones. They're designed based on real metabolic science. Semaglutide, for example, mimics a hormone that regulates appetite and blood sugar. That could be the difference between life and death. Now, here's what I'll give you my opinion, and maybe a counterpoint. I still believe that conservative treatment should always be considered first: nutrition and movement therapy. There aren't just add-ons. They are the foundation. People can't do well without them. What I see as a patient who's discouraged, who's scared, or physically unable to keep up, telling them to just try harder isn't medicine, it's cruelty. And sometimes the most compassionate thing you can do is to offer help that works. And yes, that can mean medications. So, injection before the push-ups? Not exactly. Think of it like this. It's no longer a ladder, it's a toolbox. And for some, these medications are the right tool right off the bat. This new guidance isn't about giving up on lifestyle, it's about giving people options, hope, a medical strategy that represents the complexity of obesity as a disease state. If you're struggling with your weight and you've tried everything, talk to your doctor. This isn't about willpower, it's about science and finding what works for your body, your life, and your heart. If this sparks questions, you're not alone. Comment below and I'll read them all. And follow for more real talk about your heart health. We're gonna link some videos somewhere on the screen, so click and follow along for more.